Imagine having to make the difficult choice of either feeding your family or giving them the medications that they need in order to survive. For some people, this is the choice they have to live with every day. For those without homes, those working but unable to afford their medications, those who are laid off, or senior citizens in the gap of Medicare, medication becomes a daunting hurdle rather than a boost back to health. For a diabetic, some insulin can cost them over $400 for 5 flex pens. For 1 month of a preventative asthma medication, it can cost over $350. For some antidepressants, it can cost over $200. Many patients take more than one prescription, and for those without prescription drug coverage, the cost adds up very quickly. Patients have to make frequent trips to the emergency room for treatments that could have been avoided with proper medications and regular doctor's visits. These patients need help, and Ozanam Charitable Pharmacy is here for them. Located at 571 Dauphin Street in downtown Mobile, Ozanam Charitable Pharmacy provides medications to those who cannot afford them. Ozanam Charitable Pharmacy believes that everyone should have access to the prescriptions that they need in order to maintain a healthy life. The pharmacy is named after the Blessed Frederick Ozanam, the founder of the St. Vincent de Paul Society. Following in its namesake's footsteps, the staff of the pharmacy has dedicated their lives to helping the patients in Baldwin, Escambia, and Mobile counties.
Our mission at Ozanam Charitable Pharmacy is to provide patients who are financially challenged and who are without health insurance with life-sustaining medication. We have over 100,000 individuals in our area who are living day to day without access to basic health care. And if they can make it to the doctor, they might not be able to afford the medication. And not all prescriptions are $4. Prescriptions range anywhere from $4 to as much as $21,000 a month. So in order for patients to remain productive and to have a quality of life, it's important for organizations like Ozanam Charitable Pharmacy to exist. Our mission is to always provide medication at no cost, because we know that people have to, in some cases, make the choice between buying food and purchasing their medication.
Each year, Ozanam serves over 1,600 patients by providing them over 34,000 prescriptions at no cost to the patient. These patients would have had to pay nearly $900,000 at a retail pharmacy. Without Ozanam, most of our patients would have had to choose between purchasing their medication or their food. While the staff at Ozanam Charitable Pharmacy dispenses generic medications whenever they can, sometimes they are unable to get the generics and must try to secure the name brands. Our patient assistance coordinator works directly with the pharmaceutical companies to get these name brand medications for the patients. Last year, she was able to secure nearly $650,000 in life-sustaining medication for our patients.
When someone is certified to use our pharmacy and has been prescribed or needs brand name medication, I take care of all of that through the manufacturers or the pharmaceutical companies and make sure that the patient gets that medication. I work with Annie to try to help her save money by ordering insulin and anything else that costs a lot, for which there may be patient assistance program.
Back in the pharmacy, our chief pharmacist does a lot more than just fill prescriptions.
Every day we do about 100 to 200 prescriptions, filling a 30-day supply for everyone who's qualified to get prescriptions here. I also precept Auburn University Harrison School of Pharmacy students. They're 4th-year PharmD candidates, and they are with me for like 5-week rotations. And we help them discover what nonprofit pharmacy is, and also they get to practice medication therapy management with our patients, which is a great service for our patients. A lot of them have not had any education on their medicine or their disease states.
Through Ann's preceptorship with Auburn University, Ozanam has become a location for 4th-year pharmacy students to do a 5-week rotation while working towards their degree. Due to this partnership, Ozanam is able to consult with its patients on the treatment of their chronic diseases.
My role in the MTM program is basically to optimize patients' drug therapy and improve therapeutic outcomes. And we basically do this by sitting and talking with patients about their disease states and their medications that they are on to make sure that they are getting the maximum benefit.
Every day, the waiting room is full of patients that need the help of Ozanam.
I love you all. Y'all were all part of my life. And I'm thankful every day for all of y'all.
Without the help of our wonderful volunteers and donors, Ozanam would not be able to serve the patients that need our help. Ozanam is always looking for volunteers with experience in the health field to help us with our mission. Our staff and volunteers know the benefits of health because
healthy people build healthy communities.